Hmm. Interesting. Do you feel, I mean, that's one thing I look at when I do stem cell therapy. And I always say, I tell people, I said, how you're looking on the outside actually can predict how you are on the inside, because what's going on in the face is a prediction of what's going on in your internal organs. So it's interesting that you guys are able to predict facial aging.
Yeah.
How well do facial aging correlate with internal organ aging?
It's not always perfect, certainly, especially because, facial aging has a lot of things to do with like things like sun exposure, which might happen on our tissues of our skin, but not necessarily, on our internal organs. And sun exposure is a huge issue. But with the Dunedin pace, we do know that individuals who live in the same area get approximate levels of sun exposure, are all the same ethnicity. They definitively, the pace of aging is correlated to those facial appearances. And if you see these pictures, sometimes you can see just how drastic some of that is. We have pictures of our 45-year follow-up for these patients. So they're all age 45, and we separate them into three images. We separate into what they look like as an average, what the 10 slowest aging members of the cohort look like, and the 10 fastest aging members. And the difference between the slowest and fastest aging members looks to be maybe 20 or 30 years of difference, even though they're the exact same chronological age. And I think it's always a really good metric to show people that, you can keep doing things to help fix the symptoms of aging, like, Botox, like hyaluronic acid, like retinol. All of those are good tools to help improve facial appearance. But you also want to fix the underlying cause of that in the first place, which is the actual aging process. And so it certainly correlates. And I always think that's a great example.
Yeah, that's awesome. So, so with the methylation, so I want to, let's say a patient comes to you and or comes to me and asking, well, okay, I want to know how well I'm aging, and I'm offering, well, this is a great test and can be very predictive. So how would you explain this test for some, a lay person?
Yeah, the best way to do it is just to, again, put emphasis on the importance of aging. And I think that's the most important thing to communicate, is that a lot of people think of aging as this, maybe something that's aesthetic, right? About how I look, or something vain, in terms of, a vanity type of thing. But it's really not. Aging is the biggest risk factor for all chronic disease and death, and not by a small margin. We're talking about 5 or 6 times more important than smoking status or obesity. Things that we know are really, really bad for you. And so I think that once people understand that aging itself is a problem, which predisposes us to all of these negative life experiences, hopefully they'll be motivated to do something about their biggest risk factor. And so with that being said, if you want to test that biggest risk factor, this is definitively the best way to do it. These algorithms are very new. In the case of that Dunedin PACE algorithm, it only came out in 2021, so it's not even 2 years old yet. And with that being said, it's sort of a breakthrough in science in our ability to quantify a process which previously we've only been able to do with sort of our birth dates. And so the best thing to look here is that, are you advanced aging or are you decelerated aging? If you're decelerated, that's going to be protective of every negative outcome. And so that's really where you want to be. But if you're not there yet, the answer is, how do we get there? And that's the great thing about these epigenetic platforms, is that we can actually change them. We can change them with everything that we do in our lives: medication, diets, nutrition, exercise. And so it really puts the control back into your own hands to maybe try and do whatever you can to slow your own aging.
Hmm. So by focusing on the DNA, you're saying that you believe the vast majority of aging is happening on the DNA level.
Yes, well, I should say, that's epigenetic dysregulation is one of the hallmarks of aging. But with that being said, there have been really big breakthroughs recently, which make us think that we might be able to restore ourselves with just by changing this epigenetic expression. One of the best examples are using actually growth factors called Yamanaka factors.
Mm.
And these are, this won a Nobel Prize in 2012, because what it's able to do, or these growth factors are actually able to take any cell within your body and make them back into pluripotent stem cells. So you could take, for instance, a biopsy of your skin and take those skin cells and keratinocytes back to pluripotent stem cells with this reprogramming. And so the interesting thing about this is that they've now started to use this as age reversal treatment, because when you use these Yamanaka factors, you can actually reset those epigenetic clocks back to zero. And so this has actually been done in an experiment with Harvard. They did this in eyes of mice who had lost their vision due to age-related blindness. And what they did is they injected this into their eyes. Those cells went back to pluripotent stem cells, and the mice actually regained their vision whenever they had been previously blind. And so these breakthroughs are happening on a weekly basis now in the aging field, and it's one of the most well-invested areas of scientific development. One of the companies that is most well known for this reprogramming related investigation was just funded by Jeff Bezos for over $3.2 billion as a startup, probably one of the biggest startups of all time, all focused on this idea of reprogramming and resetting these epigenetic clocks back to zero.